Air goes in, air goes out. Blood stays in. And if any of that changes, fix it. So, you're interested in shooting. Good. We need more people who are willing to defend themselves and their community. Now let's skip several giant steps and go to after the firefight. I might feel a little weird to think that far ahead, but trust me, it's better to be thinking about this now than to be sitting next to somebody bleeding, Googling a first aid tutorial.
Why the hell would anybody want to put a cat on a bullet wound? Oh, it's a tourniquet. You okay, bud?
And to be clear, one of those steps that we're skipping is getting yourself properly educated about this. There are a ton of resources where you can take classes, where you can get certifications in various techniques. There's a lot of different organizations, and it also might help to look up what are organizations local to you. I don't want you thinking about this as a comprehensive education on medical care, more as a good primer on some basic fundamentals. Think of this less full education and more how to avoid getting dead and others 2 part 1. First things first, shock is a really complicated thing. The second a fight is over, very first thing, check yourself.
Before you wreck yourself.
Even if you don't feel anything, move your arms, take a step in any direction, and try and feel if you missed anything. Take a few breaths. Remember, you really don't want to cause additional problems by trying to help and then crashing halfway through, or potentially trying to help somebody who has an open wound, and in the middle of that realizing you have one of your own. Blood pathogens are no joke. Serious as a heart attack. No, literally serious as a heart attack. Take a step back, look at your extremities, make sure you aren't missing any damage before you go on to helping anybody else. Also, give yourself a visual inspection. You might be missing something that you will see with your eyes, so quickly look to see, do you have a small open wound that you should throw a band-aid on before you start treating other people. Assuming you don't find anything, move on to your next patient. Now, everything that I'm going to cover, I'm going to assume you are applying to another person, but if you're keeping an even head, you can reasonably try to apply this to yourself as well. So you can kind of think of the damage that happens to a human body on 3 potential levels. The first are what I'll call existential threats. There are basically 3. Something's affecting the air going in and out, something's affecting the blood going around your body, and you don't have control of, well, your everything. Anything past that, even the ability to eat, is considered less of an existential threat because of the time frame in which they'll do permanent damage. Can't breathe for 7 minutes? Well, there's a new type of good news because you won't have to worry about breathing ever again. Can't eat for a day? Yeah, that sucks, I've been there. I hope you can eat soon. Last threat first. If your patient isn't waking up, address that first. You have to figure out the why of that. More importantly, you have to figure out the other possible damage from it. Are they breathing? Is their heart beating properly? If they have enough control of their bodily functions that their body is continuing to function, you can move on to the other existential threats. There are other reasons why somebody might pass out. However, if somebody gets hit in the head very hard, get them up as quickly as possible. There is a potential for brain damage there. That doesn't work the way that people think it does in the movies. If you get hit really hard in the head and don't wake up, we have a term for that. Vegetative state. You really want to make sure that people don't get into that state, and if they do, they get out of it as quickly as humanly possible. Our brains are complicated things, but during brain damage, we need to be awake. Concussions get significantly worse if you pass out. If your patient is awake and you need to assess damage, say hi. No, seriously, start off by introducing yourself and introducing your level of training. Start with your aim, ask if they're okay, then immediately go into asking if you have their permission to do what you're about to do. Part of that is going to be informing them, what level of medical training do you have? If you only have a first aid certification, say that. If you're an EMT, say that. If you have only watched a handful of first aid videos and you vaguely know what you're doing but you don't have any certifications, say exactly that. That said, if somebody is unconscious and you are doing life-saving protective measures that you know are necessary, you will generally be covered for any consent violations until the patient wakes up. Once they wake up, you now need to obtain consent. Remember, they might not physically feel damage, so running through limbs and having them move parts in order to see if anything feels hurt is a great place to start. Can you move your arm for me? Can you move your leg for me? Are frequently great ways to check for both physiological damage as well as nerve damage. If they aren't able to move a limb, you have to assess why. It could be from a physiological wound, which will be characterized by a wound and lots of blood, or from nerve damage. This will be characterized by things being swollen and in the wrong shape. If it's bad, remember your goal isn't to fix them, it's to get them patched up enough that you can move them to someone who will fix them, like a hospital. If it's tissue, immediately patch the wound as best you can. These are the wounds where once you start getting more and more experience as a medic and with first aid, you can start to make some calls about whether or not somebody needs care. Abrasions and bruises, frequently if there's no inability to move the limb, you might be able to calm someone into saying you're probably only going to need to just maybe get checked out by an urgent care. But especially when you're starting out, and generally, unless you specifically know that somebody is going to be okay and you can directly identify both the cause of the damage and the extent of the damage, tell them to go to a doctor just in case. If it's nerve damage, have them avoid moving the area as much as possible, as you don't want to inadvertently make the damage worse. Get them to a medical center as soon as you can, either a hospital or an emergency care facility that has the ability to do x-rays. Once you've confirmed it's nerve damage, treat the symptoms and get them ready to move. Short, portable imaging technology, you're really not going to be able to diagnose or even begin to treat most nerve damage wounds in the field. Second primary threat. Air goes in, air goes out. If something is obstructing the person from breathing, that is the next level of existential threat you need to worry about. Choking on something like a physical obstruction can be cleared normally with the Heimlich maneuver. The Heimlich maneuver, the friendliest way to punch your friend in the gut. There's a common injury with gunshot wounds called a sucking chest wound, or an SCW. Essentially, this is an open wound in your chest where something has penetrated the lung. If air is going in and out, but it's super weak, and you can see a pinkish tint at the wound site, as well as you can hear almost like a squeakiness, like a broken whistle every time they're trying to breathe, there's a good chance there is a hole directly in the lung. First, make sure there's nothing in the wound, but don't pull anything out that's firmly lodged in. If there's something loosely covering it, like dirt or something that has just fallen into the wound site, you can remove that. However, anything like a bullet, don't want to remove yet. Paradoxically, you might do more damage by removing it. Or worse, that bullet could be blocking an artery. It's especially common with gunshots where, because of the way blood works, it will tend to congeal around masses. If you remove the bullet or the thing that is connected, you're also reopening those wounds and ripping out all of the things that had stopped blood flow. You might have giant blood loss problems immediately after, so keep everything in place. Have them breathe out. Then, using something as sterile as possible, you want to plug that hole. A plastic wrap on top of it, medical gauze and medical tape would be the best option, but if all you have is plastic tape or some kind of saran wrap even, have them breathe all the way out. Make sure what you're using has been disinfected, and then immediately after they breathe out, apply it and seal it to the wound. Tape it down with gauze and medical tape as quickly as possible, and then transport them to a competent surgeon. Try to have them move as little as possible, because even small motions can tear the delicate healing tissue. And the third primary threat is blood going around the body, or being obstructed from going around the body. Major bleeding is a serious issue, but establishing why there's bleeding is going to be your first step. That sounds weird, but making sure you're identifying the proper wound site and not a superficial lower wound site is super important. Cut away clothing if you have to. Find where the main wound is. Massive bleeding will eventually lead to there being not enough blood to, live, so you better get on that. Keeping pressure on the wound can be the difference between avoiding getting dead and not, as you can reduce the amount of blood that comes out. If the wound is on an extremity, a tourniquet will be your best friend. An actual combat tourniquet is always best, but if you happen to have any long strip of fabric that won't tear when pressure is applied to it, it can be used as a tourniquet in a pinch. Throw that shit around and put it as tight as you can. If the blood is still coming out, you haven't put it tight enough. Don't worry about it being too tight and cutting off blood to an extremity. Worry about your patient being alive. That's the goal. There's already been damage to the arm. You're now worried about that damage spreading to the everything. As for things like bruises and abrasions, unless you're talking extreme versions of these, you can usually disinfect, patch, and move on. It's important to note that disinfectant is important. It's important to note that you should clean these wounds to make sure that people aren't getting infected. You can die just as easily from an infection as you can from a bullet. But clean them up, patch them up, and move on. That said, if you see a rather extreme version of these, that's still a desperate need for medical care, particularly bruising. You have to remember, bruising is blood that is under the skin that is healing something. Why it's there can vary, but if you see very, very large bruises and you can't necessarily determine why, there might be internal problems that have spilled out. Bruising is loose blood and fluid that is designed to help you heal, and in the event that there is a lot of bruising, you should figure out why all of that fluid is collecting there, because you should figure out what the damage has come from, and if you can't name it, well, you're gonna have to figure out why your fluids are not where the other fluids are supposed to be. Look, bodies are sacks of fluids, and to be honest, I'm embarrassed to have one. One last thing. The person who told you that you can use a tampon in a bullet hole is both right and a complete asshole. You can use a tampon in a bullet hole, but frankly there are so many better options that if you're bringing them with you, intending to use that for that case, you're bringing bad tools. It's like bringing a super soaker full of acid to a gunfight. The internet's gonna love you for it, but it's probably gonna backfire and hurt you worse. See, tampons are designed to absorb blood. They do this job quite well. If you are trying to heal and you shove a tampon in there, that might temporarily close the wound. However, you're going to create a worse one trying to get the tampon loose later. There are already specifically designed bandages for bullet wounds. Thank you so much for watching. If you want to support me, you can follow me on Patreon, where all of this content drops a day early, as well as gets your name here. Hit that like button if you liked the video, and if you didn't like the video, take some spray paint and just cover your monitor in a thick layer of it as punishment for showing you such travesty. Hit subscribe if you haven't already. Come on, hit subscribe. It's right there. You know you want it. You know you want it. You know you want to. It's a juicy red button. You know you want to press it. This is the Queer Armorer, signing off. And remember, moral doesn't mean legal, and Stonewall was a riot. Peace.